Hi everyone. Today we have another topic parathyroid glands. They are developed from third and fourth brachial pouches from the two type of cells called oxyntic cells and chief cells. Chief cells are the one which secrete the parathyroid hormone, the precursor for the synthesis or pre-pro parathyroid hormone. Parathyroid hormone binds to parathyroid hormone receptors and activate adenyl cyclase cyclic AMP pathway that causes increase in the phosphate absorption in the PCT. As I mentioned, at the source of the parathormone, chief cells, and mechanism of action was mentioned, and main action of parathyroid hormone acts on three important structures or systems or organs in the body, and particularly on bone it increases calcium absorption. And in the GIT, parathyroid hormone causes increased calcium and increased phosphate absorption, and that is mediated by vitamin D. In kidney, calcium absorption is increased in DCT and the phosphate is decreased, the reabsorption from the PCT. So ultimately, the major aim or major purpose of parathyroid hormone is to maintain hypercalcemia and hypophosphatemia in the serum. So these are the overall actions of the parathyroid hormone acting on three structures with the source and mechanism of action. In continuation of the previous slide, and this flowchart shows how does the parathormone causes resorption of the bone and by activating the vitamin D and by releasing the osteoprogen ligand. So this causes proerythroclast differentiation and which releases proteolytic enzymes or released by osteoclast, then the bone resorption occurs. This slide shows the action of parathyroid hormone and vitamin D on the bone, causing a resorption of the bone, adding of the calcium to the serum, blood serum. So here parathyroid hormone vitamin D acting over osteoclast, so thereby and it they causes bone resorption. See over there, osteoclast, acid secretion, lysosomes are released, and so the membrane getting okay filtrated. Thereby, finally, the calcium removed from the bone is added to serum calcium levels. Bone calcium is maintained. As like the previous flow chart, here is a this is also a flow chart. In the previous slide I mentioned clearly, when the plasma calcium is decreased and it acts on parathyroid gland and decreases parathormone, acting on the three structures like bone, kidney and intestine. So by acting on these structures, okay, so normal calcium level is maintained. The normal calcium level is 9 to 11 milligram per dl. Under the applied aspects, we have divided into two categories. One is called the hypersecretion of parathormone, the other one is hyposecretion of parathormone. First, we'll see the hypersecretion is of two types, primary and secondary hyperparathyroidism. The primary hyperparathyroidism is also called hypercalcemia, where it is caused due to adenoma of the parathyroid secreting excess PTH hormone. So hypercalcemia, hypophosphatemia, calciuria, abdominal pain, bone pain, nausea, vomiting, peptic ulcer, renal stone, and constipation. So bone shows some cavities that are, osteitis fibrosa, cystica are some of the features of the primary hyperparathyroidism. parathyroidism. The secondary parathyroidism is due to chronic renal failure. The clinical features includes chronic hypocalcemia leads to hypertrophy of the gland that secretes excess amount of the parathyroid hormone secretion. It is a partial or complete removal of the parathyroid gland during the surgeries, and it shows some of the features like tingling, numbness in the extremities. When the calcium concentration is less, causes increased membrane permeability to sodium. Hyperexcitability is seen in the patients. And when there is a laryngospasm, stridor, and causes asphyxia and finally death. Chavastic sign, that means tapping over facial nerve, that causes contraction of the jaw in front of the ear causes. And the carpopedal spasm is very important part of feature of the hypoparathyroidism. It occurs, or this can be done spontaneously seen, or can be demonstrated even by applying the pressure using the BP cuff over the arm. There you can see flexion of the wrist and the thumb with the hyperextension of remaining fingers. This is also known as abstrasian hand or Trojer's sign. Some of the visceral manifestations like a biliary colic, intestinal colic, and bronchospasm can also be seen. Cataract formation is observed due to calcium content in the lens is increased. These are the manifestations of the hypoparathyroidism. Out of all of them, and you can observe the carpopedal spasm is to be noted, and very important is also known as tetany. Tetany is very important question for the examination point of view.